Hello, this is Samsarah Morgan. I'm the Executive Director of the Oakland Better Birth Foundation and Nia Healing Center for Birth and Family Life. I hope that you and your family are doing well during this time of crisis. I hope that you're snuggled down together, sheltering in place. I hope none of you are ill, and I hope that those of you who are ill have the ability to access the health care that you need and are on the mend. My prayers are with us all. I'm here to talk to you about a situation that's been going on now since this crisis started and since the shelter in place was put in place in the Bay Area. And that situation is that our hospitals, Bay Area and nationally as well, are not allowing doulas to fulfill their obligation to their clients and support them through their labor and deliveries. We all know, and it's been well documented, the positive effect and the life-giving effect of doulas in the birth room. We all know at this point that doulas help reduce infant mortality and maternal mortality. We know that doulas increase the mom's sense of self-worth, her sense of ability and agency in her birth process. We know that doulas help strengthen the bond between birthing people and their partners. We make sure that there is a space where the partner is seen and heard, where the partner has skills to support their partner through the birth process in a way that builds cohesion in families and increases affection in families and their devotion. And as well as all of that, doulas are also very supportive to the hospital staff. We're there with one patient, and a hardworking nurse can be called to monitor 20 patients at a time. So we're there with the patient, that one patient, taking care of that person's needs, that person's mate's needs, and doing things that a nurse would be called into the room to do. He's freed up to take care of other patients and handle other obligations, knowing that a doula is there. I've been many times very pleased to have nurses say to me, "I'm so glad that this family has a doula. Thank you for being here." And it's always been my honor to be here, and it's always been an honor to have trained the most amazing doulas anywhere to be there for their clients. So it really doesn't make much sense that a part of the healthcare team, such an essential and such a helpful part of the healthcare team, is being kept out of the mix. Yes, we want to reduce the number of people going in and out of hospitals. Hospitals are very germy places. We really do. So we want to remind everybody that when a doula is working with their client or his client, that person we're only in one room. We're only the doula and the patient, the doula and his or her client. Nurses and doctors are going from room to room to room. And I know that folks are doing the best they can and following the protocols around sanitation and disinfecting. But as hospitals struggle with supplies, it's pretty challenging. So if we want to reduce risk, having one caregiver that's just there supporting that client through a non-medical time, a labor is not a medical event. So there's really no need for a nurse or a doctor to be in the room until it's time to push out the baby. The monitor's there. The medical folks can monitor from the nurse's station, which they already do. And if a laboring person needs hands-on support, massage, double hip squeeze, music, scents, getting in and out of the shower, all of those things don't need to be done by a registered nurse. A registered nurse could be with somebody who needs their professional medical assistance. So we at the Oakland Better Birth Foundation, we're putting out a letter requesting most respectfully that medical people review their thinking on this to truly put the needs of birthing people and their families first. It's already understandably tragic that folks can't have grandmas with them. Usually at a birth, the hospital allows a few people in the room, and we certainly thank them for that. So the grandmas who can't attend, well, grandmas need to be concerned about the virus more than other folk, but you know, aunties, best friends, there are other wonderful people who would have been able to attend the birth of their new family member, and they can't, and they are respectfully staying home. Of course, the birthing person should have their partner with them if the partner wishes to be there. And the birthing person should not have to choose between their partner and their labor support. The most devoted partner in the world is not a labor support person. We don't, labor support people, doulas, we don't take the place of the father. We can't take the place of the partner. The partner, the love and support and hands-on support of a partner, the value of that can't even be quantified. And at the same time, unless the partner has taken doula training or has had the amazing gift in their life of having supported a few women or birthing people and having babies, knowing what to do is challenging. And knowing what to do for your own mate is challenging, even if you have taken care of other people. When my beautiful grandchild was born and my daughter-in-law honored me to ask me to be her doula, I declined because this is my family member. This was my first grandchild. This was not a place where I could be fully in my professional self, even though I've been professionally a doula for my entire adult life. So in trying to manage this unmanageable situation, I really request that hospitals rethink this and to truly put the needs of laboring and pregnant people first. It's not just enough to get the baby out. It is important to get the baby born into the world without trauma. And we all know there is scads of science to prove that an organic birth, spontaneous labor, and delivery of a baby vaginally has lifelong benefits for that infant and for that birthing person or mother. There's no debate on that. Generally speaking, our pregnant people, our mamas, are the most healthy people in our society. They're not sick. They are healthy. And based on the information that we have up to this point, they're not at a higher risk for COVID-19 than the general population. But during this period of time, since we were foolish enough to put labor and delivery units in the hospitals where sick people go, as opposed to having separate maternity units as they have in Europe, since we were foolish enough as a country to put labor and delivery units in the hospital where sick people will be coming in to receive treatment, and now we're going to punish them by taking away their support person. Please rethink this, and please consider that once this crisis is over, consider the value of the memory of an organic, empowered, fierce, maybe difficult, maybe not, but always blessed and always amazing birth experience. Amazing. Imagine how having been able to have the gift of that experience will help people rebuild their lives. There are people who lost their jobs. There are mothers who were stressed out. There are pregnant people who are stressed out because they already don't know if they're going to get their work back when they're off maternity leave. They don't know if their partner is going to be employed. Their friends are losing their jobs. It's a great deal of stress going on right now. And medical people, that it is scientifically proven. It's not just some fuzzy, crunchy granola idea. We have science to support that spontaneous birth, loving birth, music, chanting, crying, praying, singing, all of those things, all those non-medical things that busy medical people don't have time to provide, even if they wanted to. I know there's many wonderful nurses out there. I've worked with them. And, they've expressed their desire that, gee, I wish I could be a doula. It's great what you're doing for the client. And I'm like, yeah, I agree. It's great what we're doing for the client. It's also great what the medical people are doing. Let doulas do their job, please. Let us do our job. We are getting reports. I'm getting reports of people having abusive experiences in some of our hospitals. I'm very sad to hear that. I'm also getting reports of doulas being turned away and families being told that they can't have their doula with them. I'm going to include a Google document with this video, and we are compiling all of those incidents. So if you are a doula and you went to the hospital with your client and they refused to let you in, please find out who the administrator on call was when you came in. Please see if you can speak to that administrator. We will provide a letter for folks to show the administrative people. Oakland Better Birth has written a letter. Cornerstone Doula Trainings has written letters. A1 has written letters. There's several organizations that are advocating to allow doulas to continue to serve their clients during this crisis. If you're refused admittance, of course, be extremely professional and to take your leave. Hopefully you can support your client virtually, by phone, text, Zoom, Skype. There are other ways that you can be there for your clients. It's not optimal, it's not the best, but it's what we got. But please document all of these incidents, because in the future we will be going back to them and using them to make sure that future crises are handled in a more pregnant person supportive way. If you've suffered any kind of abuse, if you are birthing in a hospital and anyone's been rude to you, and the staff has been rude to you, if you feel you were pushed to have an epidural, if you feel that you were pushed into agreeing to a C-section, please document that as well. Again, I wish you the very best. I send healing and love to you and your family. I'm hoping that this all can end pretty soon and that we can start to pick up our lives. I'm sure we will learn valuable lessons from this time, as crises always nets into valuable lessons being learned. That day-to-day might be challenging. Keep an eye on the Oakland Better Birth Foundation's Facebook page and Nia Healing Center for Birth and Family Lives Facebook page for updates and for helpful things we're going to offer, things that we hope will be helpful to the community. Online childbirth education, online pregnancy and pregnancy coaching and family life coaching. So those things will be available. If you need anything, please send me a message through Oakland Better Birth Foundation's Facebook page, or you can email us at oaklandbetterbirthfoundation@gmail.com. I wish you the very best. And again, send love and light. And we can do this. We can get through this. I love you.